Hello, my name is Dr. Kiva Collier. I'm a preventive medicine resident at the University of Rochester Medical Center in the Department of Public Health Sciences. And today I would like to speak with you about ways to remain healthy and safe this summer. The summer can be a fun time. It is a time when families travel to the beach and take vacation. They go to amusement parks, they reconnect with other family members, and do other fun activities. But in the midst of the fun, we can neglect to keep our health a priority. Here are some preventive health and safety tips for you to use this summer. Never swim alone. Children should always be supervised by an adult that knows how to swim. Do not swim too soon after eating. When you eat, blood is directed in the body to areas where it is needed most to digest food. Therefore, you may not be strong enough to swim properly. Wait at least 30 minutes after eating before getting back in the water. Wear insect repellent that includes DEET to keep biting insects away. Travel with a first aid kit that includes bandages, anti-itch, and antibiotic ointments for cuts and scrapes. Bee and wasp stings are common during the summer. Avoid nests to decrease your chance of multiple stings. If you are stung, remove the stinger immediately, keep the area clean, apply ice to reduce swelling, and apply an anti-itch cream to reduce irritation and pain. Some people only experience a reaction at the site where they are stung. But if you know you have a severe allergy to bee stings or any other severe allergic reaction, be prepared by carrying your EpiPen. Signs of a severe reaction include trouble breathing, dizziness due to a drop in blood pressure, and/or hives. If you experience any or all of these symptoms, seek medical attention immediately. Wear sunscreen with an SPF of 15 or higher. Most sunscreen lasts from 30 minutes to an hour and must be reapplied after swimming. So reapply it often while you're outside. If you find that you do get sunburn, which is redness of the skin, then often a good lubricating lotion with aloe will help the skin feel less irritated. However, if you develop severe blistering of the skin, this may indicate a deeper burn, so seek medical attention immediately. It is important to stay hydrated during the summer. Drink water and beverages with electrolytes, but not too much sugar, every 15 to 20 minutes if you are outside in the heat for over an hour. This helps replace salt lost during sweating and retain fluid in the body. Avoid consuming a lot of sugary drinks, such as soda, as they do not hydrate you as well. Knowing the warning signs can help keep you safe. Cramping in the legs or heat cramps is a sign of a loss of electrolytes such as salt. So it's important to stay hydrated. Heat rash or prickly heat is a rash that are raised red bumps that appear on the legs and the arms in areas that are wetted by sweat. It should disappear when you go into a cool environment. If you develop an increase in heart rate, hot, dry skin, a throbbing headache, confusion, or stop sweating, this is a sign of heat stroke. Heat stroke is a medical emergency. Seek medical attention immediately or call for help. Come out of the direct heat or go to a shaded area. Remove outer clothing as you wait for medical treatment. Drink fluids to let the body cool down, but if it progresses, use ice packs. Use this time of sunshine and longer daylight hours to be physically active and make healthy food choices. Try to build up to at least 30 minutes of exercise every day. Track your steps using a pedometer, a watch, or an app on your cell phone, and work your way up to 10,000 steps a day. Balance the calories you take in from food and drink with the calories that you burn from your daily activities. If you smoke, choose this time to become tobacco-free. Talk to your doctor or other healthcare professional about ways you can quit tobacco use. The Healthy Living Center at the Center for Community Health and Prevention provides tobacco cessation counseling, and treatment for options for all who are ready to quit smoking. For other tips on how to quit, call the New York State Smokers Quit Line at 1-866-NY-QUITS or call the national hotline at 1-800-QUIT-NOW. If you drink alcohol, it is recommended to have no more than 2 drinks per day if you are age 65 years or younger. If you are over the age of 65, have no more than 1 drink a day. A standard drink is 1 12-ounce bottle of beer or wine cooler, 1 5-ounce glass of wine, or 1.5 ounces of hard liquor. And always drink responsibly. Avoid driving or operating any type of machinery such as boats or jet skis if you have consumed any alcohol. Get the screenings you need this summer. Screenings are tests that look for disease often before you have any symptoms. Some examples include blood pressure checks, vision, hearing, cholesterol, and diabetes screenings. Have a screening test for colorectal cancer starting at age 50. If you have a family history of colorectal cancer, you may need to be screened earlier. Others are more gender specific, such as cervical cancer screening for women over the age of 21. Talk to your doctor or other healthcare professional to determine which screenings are best for you. The change in weather does not always enhance our mood. If you are feeling sad, down, hopeless, or have little interest or pleasure in doing things you usually find enjoyable for the last 2 weeks or longer, talk to your doctor. Your emotional health is just as important as your physical health. I hope these tips have been helpful to you. Have a safe and enjoyable summer.